Good morning, everyone. Hello, I'm Kelly Stoddard-Poor with AARP Vermont, and on behalf of AARP Vermont and our partners, I want to welcome you to our informational webinar on Age Strong Vermont, which is a new 10-year multi-sector plan focused on making Vermont a great place for all ages and stages of life. The Age Strong Vermont goals are big. The plan touches on all aspects of aging well, and it seeks to expand and strengthen the partnerships across state government, businesses, nonprofits, and communities, all while reframing aging and making Vermont an age-friendly state. I'm really happy to have you join us this morning for you to be able to share some of your reflections on the plan, ask questions, and provide feedback. I'm joined by my partners this morning from the Department of Disabilities, Aging, and Independent Living, often referred to as DALE. We have Angela Smith-Jang, who is the Director of the Adult Services Division, and Kirsten Hansen, who is the Project Coordinator for the Action Plan on Aging Well. So our morning will first begin with Angela providing a presentation on the plan, which will provide a great overview of all the different aspects covered within this 10-year plan. And then we'll open it up for some Q&A. So if everybody could just let me know where they're joining us from, if you could open up the chat feature and pop in your name and also where you're calling in from, and maybe just share what you like about getting older. For me, I like that every year I feel like my confidence gets better and better as I age. So if you could just share that in the chat, that would be terrific. I'd ask everybody to stay on mute while Angela is presenting. When we open it up for Q&A, if folks could use the reaction down below, raise your hand, and I'll call on you. You can ask your question, come off of mute. If you prefer to put your comments or your questions in the chat, please feel free to do that as well. We'll be saving all of that information. This webinar will also be recorded, and we will share out the link afterwards to that, and also a link to the plan itself and for more information there. But before I turn it over to Angela, we just want to do a quick poll with folks. So I'm going to go ahead and pull up the poll. And we want to know what your top priority is as you age. Is it health and wellness, caregiving, financial security, housing, transportation, and infrastructure? So we ask you to only pick one option, which I know is really hard because I think we could all rank those in order of importance. But we'd love to hear from all of you. I'll give you just a few seconds more. All right. I know we've got a small group here, so it's not necessarily reflective of Vermont as a whole, but I'm going to go ahead and share the results here. And so we have health and wellness, but caregiving as the top one at the moment. I know that when we were doing a number of our listening sessions and really in focus groups across the state, financial security was one of the top issues that continued to rise as level of importance. We know that they all are important, and Angela is going to be sharing all of the great work that is outlined in the plan on all of these issues. So I will go ahead and turn it over to Angela. Angela?
Thank you, Kelly. I am going to try to share my screen. Can you let me know if you can see that?
Looks terrific. Thank you.
Great. Thank you. So happy to be with you all today and to share about Age Strong Vermont. My name's Angela Smith-Jang. As Kelly said, I work at DALE and in the Adult Services Division, and so our division oversees supports and services for older Vermonters and Vermonters with physical disabilities. And so just wanted to give you a little bit of an overview around why we've created this plan, what's important about it, and go into at a high level what's included in the plan, and then really looking forward to your thoughts and feedback. So in many states, it's called a multi-sector plan on aging because it's really all-encompassing of sectors across society that are included in this type of plan. why do we need this type of plan when we have so many state plans already? Because this is big and broad, addressing our demographic shift. So we know Vermont is an aging state. Our population of folks 60 plus is growing, whereas our younger population is shrinking. And so it's really important that we focus on the older population and what we can do to make Vermont a great place to age well. Also, we were called upon to do this work from the Older Vermonters Act, which passed in 2020 and called on the state to create this type of plan. This plan can also be, I'm getting a little bit of feedback, not sure. If folks can stay on mute, that would be great. This plan can also be a vehicle to help elevate issues around aging and drive culture change to really shift the conversation from aging being a negative to aging being positive for all of us. Also, we asked Vermonters in the Vermonter poll earlier this year, which is a statistically representative statewide survey conducted by the UVM Center for Rural Studies. We asked a couple questions in the Vermonter poll. Does Vermont have the resources to address the needs of the older population as it continues to increase? And 64% of Vermonters said no. When they were asked how important it is for Vermont's elected officials to prioritize and invest in a multi-sector plan on aging, 81% of Vermonters said very or somewhat important when responding to that question. So Vermonters really want us to be looking at aging and investing in aging and really trying to make it work for everyone. This type of plan is also different in that, and it's the first that we've done this type of plan in Vermont. So it's the first of its kind. It's providing a 10-year vision for the state. It doesn't have all the answers, but it has a lot of important goals and a number of strategies to help get us there over the short term, medium term, long term. This type of plan also really, as I said, is multi-sector, and what that means is it's not just looking at issues that are around supporting older Vermonters now, but it's about making Vermont livable for all. That's what we're talking about when we say create an age-friendly state. It's a state that works for older Vermonters, but also younger Vermonters everywhere in between, so that we can all thrive. And the way to do that is really through expanding and strengthening partnerships. So we need an all hands on deck approach, government, business, community, everyone working together. So it works to leverage existing resources to meet some of these key goals. It puts equity at the forefront, really ensuring that no one is left behind in this work. And then, as I said, communicating in a new way about aging, thinking about energy, opportunity, and possibility as we move forward through the years. Just wanted to give you a brief sense of the development of this plan. It's been a very intentional and collaborative process developing this plan. It was certainly led by Dale and our partners at the Department of Health, but many, many stakeholders contributed to the development of the plan. We created an advisory committee in 2021, diverse representation from across state agencies, community-based organizations, older Vermonters, and family caregivers. And that committee has been very involved in the development of the plan, providing input, feedback, and working to develop the objectives and strategies. We conducted a baseline assessment in 22-23 that included a broad public survey. We heard from over 3,000 Vermonters, public listening sessions. We heard from about 100 Vermonters in 6 different sessions. We did focus groups with historically marginalized communities to really get their unique perspectives for the plan. And then we did interviews, expert presentations, and a lot of data gathering. So really looking at all of that to inform the development of the plan. We participated in a 10-state learning collaborative with other states around the country. There are only 4 other states that have this type of multi-sector plan, so we are the 5th in launching our plan. We rebranded in early 2023 to just from the Vermont Action Plan for Aging Well to Age Strong Vermont. So now we have that, and we're able to promote on social media, and we have a web page. And then we worked this spring and summer to really develop the plan. We had 7 subcommittees from our advisory committee focus on 7 different areas from the Older Vermonters Act in terms of developing objectives and strategies. And we put that all together into the plan that was released in November. So want to turn now to the content of the plan. The focus areas within the plan are from the focus areas that are the principles called out in the Older Vermonters Act. So 1, affordable aging, really thinking about financial security as we age. Healthy aging for all. Social connection is key. Infrastructure for the future, so thinking about housing, transportation, community design. Valuing family care partners or caregivers. The fight for justice, which is really around our preventing elder abuse, neglect, and exploitation, and strengthening systems of support, all kinds of support. So I want to touch just on the objectives within the plan. We don't have the ability to go in depth into all of the different strategies within the plan. I encourage you to read the plan and dig a little deeper if you're interested. But I just am going to share the high-level objectives today. So under affordable aging, the objectives are to increase the amount of income available to older Vermonters, increase older Vermonters' participation in the workforce, and support initiatives that enhance education about retirement, really a lifespan approach to that. Healthy aging for all. These objectives are really connected to some core measures at the health department, where we're able to look across the population at things like comorbidities. So one objective is to reduce comorbidities. We're thinking about heart disease, cancer, diabetes, those things that reduce our health as we age. Increase exercise, decrease hunger, reduce falls and fall-related deaths, and stopping suicide. All of those are areas that the health department and all of our partners want to focus on together around healthy aging. Social connection is key. The reason that this is a key part of the plan is there's a growing body of evidence, and I'm sure that, this can be felt in communities that you live in too, that social connection is really tied to our health and well-being as we age. And that if we are socially isolated or lonely, we are at higher risk for a multitude of health challenges. So first and foremost, we want to increase awareness and identification of social isolation and loneliness among all older adults. Then we want to also support and strengthen our network of places where older adults gather for social connection, thinking about our senior centers, adult day centers, other local community institutions where older Vermonters gather, libraries, churches, etc. And ensuring those places have accessible and equitable programming for older Vermonters. Increasing volunteerism is also an important goal, which is a win-win for everyone, and really supports health and well-being as we age. So increasing volunteerism of older Vermonters, and then also increasing the number of intergenerational education engagement opportunities, implementing different types of models. There are great models out there around how to do that. Infrastructure for the future, as I said, is housing, transportation, and community design. We broke these apart and have objectives under each category. So for housing, we want to increase the units of high quality, affordable housing that are in walkable areas. So within community centers, so that people can age well. Increase age-specific housing available for those who are 55 and older as well. Given our demographic shifts, really being able to focus on age-specific housing, and then also supporting older adults' ability to age in place, which means being able to remain in your own home or a supportive living environment as you grow older and not having to move every time your needs might increase. Transportation, focusing future transit service to encourage designated growth zones. So really maximizing our limited transportation resources in concentrated areas to really support accessible transportation. Expanding our older Vermonters and persons with a disability transportation program with increased funding and not having to deny anyone a ride that they might need, not only to get to things like a medical appointment, but also to get to things like the grocery store or the senior center for a meal. Increasing access to walkable, bikeable, and transit-friendly communities that facilitate independence and aging in place. Pretty self-explanatory, but so important as we think about really being able to age well when we may not be able to drive anymore. Being able to have transportation options are key. Community design as well is very important. We want people to have access to accessible, inclusive public spaces, indoor and outdoor, by encouraging those smart growth and really looking at how we develop different our village and town centers. Next, very important is valuing family care partners or family caregivers. This is something that at Dale we track through our annual, every 4 years, our state plan on aging needs assessment. We ask a lot of questions around family caregiving, and what we find is that family caregivers are providing more and more care, and it's having an impact on people's health, well-being, financial security, and more. And many people don't know about the resources that are available to family care partners. Resources like education, training, respite options, adult day options, etc. So these objectives are really trying to address some of those gaps. So reducing the amount of care that family care partners have to be providing by providing other supports, increasing the percentage of care partners who know about options, increasing the percentage of family care partners who know about options for taking care of themselves and their loved ones, and then reducing the number of care partners who report a negative impact on their financial security due to caregiving. So lots of work to be done in this realm. The fight for justice. First and foremost, we want the state to establish policies and interventions that are appropriate and allowable in cases of self-neglect. A couple of years ago, there was an important report that came out from the Self-Neglect Working Group, which outlined a number of things for us to do as a state. So really wanting to take those recommendations and put them into policy and practice. Also, wanting to make transparent and publicly available data around our long-term care facilities survey and certification data. So this is when facilities are rated based on the quality of care that they provide. We really want to make that more accessible so that people can make informed decisions around their care for themselves and their loved ones. We all want to be able to do that. Also, creating safe emergency housing for victims that can provide some level of medical care or long-term care services. Right now, if you're a victim of domestic violence, for example, and you're an older Vermonter who has long-term care needs, you can't go to a DV shelter. Your only option, if you need to leave, is to go to the hospital. So really being able to make our emergency housing system, whether it be for victims of crime, victims of violence, or our homeless system generally, making that age-friendly as well, that can provide supports and accommodations for people as we age. And finally, coordinating and connecting our various elder justice programs and services so that there can really be high quality referrals and collaboration. We don't want people to have to call 10 numbers to try to figure out what to do to report abuse, neglect, or exploitation. Finally, last but not least, the strengthening systems of support. So what we heard really loudly and clearly through the listening sessions and surveys and focus groups was that people really don't always know what resources are available, where to call, how to get information, and then when they do, how to navigate the systems for support. So what we wanted to start with here was really creating a set of standardized protocols, competencies, and training for our, the front door towards services, our providers that do information, referral, and assistance. They're helping people find out about programs and services and get to the right place. So really making sure that those systems are robust and doing that work well so people have a good experience. And then ensuring that we have similar no wrong door methods for reporting abuse, neglect, and exploitation, so that that's really clear and people can really get the support they need as quickly as possible in those emergency cases. And then finally, increasing the number of older people and family care partners who are knowledgeable about the programs and services that we have here in Vermont, knowledgeable and then able to access them. So that's the bulk of at a very high level, the content of the plan. And of course, the actual plan goes into much more detail, as I said, but I'll stop there in terms of content and just want to give you a sense of our next step. We are wrapping up the public comment period today. So still encourage you to share comments online if you would like, or to share with us as we talk today. And then we'll be incorporating all of the public feedback we've received, and we've received quite a bit, which is great. Incorporating that back into the plan over the next month, having our advisory committee review and finalize the plan towards the end of the month, and then launch at the start of 2024. Implementation will begin by creating an implementation committee that really will hold us accountable to making progress, moving forward, tracking outcomes, ensuring we're meeting milestones, and that the data is driving us forward. And then we'll also be working in the beginning of 2024 to identify some of the strategies that we can move forward more quickly, that don't require policy change or a great amount of funding. Maybe they just require a new collaborative approach, and we can get those started right away. And then we'll be slowly working towards some of the more aspirational parts of the plan that will take more work over the next 5 to 10 years. So I want to make sure you have the link to where you can find more information, learn more, and read the plan. So it's at healthvermont.gov/AgeStrongVT. We'll put that in the chat as well. You can also reach out anytime, even if, post public comment period, we welcome thoughts and ideas and feedback anytime. You can also join our newsletter on the website, and AgeStrongVT at Vermont.gov will work to reach out to us or join the newsletter. So I will stop presenting now, and I really welcome your questions, your ideas, your comments, your concerns. As you think about aging in Vermont, does this plan make sense? Is there anything that isn't clear? What resonates with you? What do you find really compelling? Is there anything missing that you really think should be part of the plan? Or what would you like to see highlighted more? So those are just some questions to get us started, and I will stop sharing my screen.
Excellent. Thank you so much, Angela. Really appreciate it. There is a comment here in the chat from Douglas. He said this was just stating that having access to the navigators or subject matter experts to inform and guide is very important, and he's just really happy that that's one of the objectives. If other folks have a question, if you can hover down on your taskbar at the bottom, you can pull up the reactions button, you can raise your hand and I will call on you, or you can put a question in the chat there as well, or any comments that you have, any clarification that is needed. Well, Angela, I have a question for you. So with the start of the legislative session coming up, just around the corner in January, what are some of the kind of top issues that you're hearing that the legislature is interested in taking up from the plan? Have you had any indication of some of those priority areas?
Oh gosh, there are many areas that I think the legislators have been hearing about off session, that they'll want to work together to address during the session. Some are the same as in previous years. I think that the challenges around housing and the workforce shortages across our systems of care, I think both of those will be major topics, as they have been in previous sessions, but they'll continue to be. I think as and related to that is, funding, Medicaid funding for long-term care will be an important topic, as well. I think those are probably the two really big ones that come to mind. I know that there's a legislative interest in supporting family caregivers as well. I don't know that a clear, path has been identified on exactly what to do, but there are several reports coming out early in the session, from working groups, that I think might give legislators some, something to start from as well.
Excellent. Thank you so much, Angela. Oh, I see, Regina, you have a question. You can go ahead and take yourself off of mute and you can ask. There we go. Go ahead. We can't hear you yet. Oh, we still can't hear you, Regina. Do you want to try putting your question in the chat? You're off mute, but we can't hear you. Have you checked your volume? While Regina's figuring out her volume there, we did get a comment here in the chat from Tree. A directory of vetted service providers, paid and volunteer, who can help with things like shoveling snow, changing light bulbs, yard work, etc. Vetted providers who may even have some state provided basic training, and helping older adults would be great. Oh my goodness. Yes, absolutely. Tree, I've been in discussion with Cathedral Square about this for, I don't know, a number of years, because it's been such an identified need of, vetted services that can help with home maintenance, etc. And knowing that, we also know that scams and frauds, for a lot of older adults, they're highly vulnerable to a lot of scams, but making sure that people have access to those types of services. Did that come up at all in the plan?
That, not as specific as this, but it certainly did come up that the range of things that people need is, we talk a lot about folks who need supports at a high level, right? They need long, supportive care in the home every day. But many older Vermonters speak to, being themselves able to take care of themselves, but needing that extra support around, chores around the house and home maintenance. So I do know, like, I think that the village model is one sort of response to this need where there is kind of a community cohort that does that vetting and then provides a list of folks of those types of services, or coordinates volunteers for some of those types of services for folks who need that as well. And the village model has really taken off in some of our rural communities. The Mount Mansfield villages in I think it's Underhill, Jericho, and Cambridge are the three towns that have come together to create that type of network for support. But it'd be great to have that really in many communities across Vermont. So I definitely hear that.
I have to come off of mute. Thank you, Angela. Regina, were you able to figure out your volume?
Well, I want to check. Can you hear me now?
Yes, yes,
All right,
wonderful.
Two things. One is I work as a registered nurse consultant. My main occupation or mission is to help people stay at home, those who want to live in their own homes as they grow older. And so I think that since I've been doing this work, I've discovered that I didn't discover it really. I think I kind of knew it. I'm old, as you can see. And I think that an advantage I have is that I am old. I do live alone, and I'm around this healthcare business now for a very long time. And I think that the issues that exist in the home for older people are not really known to us as a healthcare provider community. They're not as straightforward as one might think. There's more detail to them. There's some more discrete kinds of issues that persons trying to navigate this shark infested waters of living at home, especially alone, with in a rural setting with distant relatives. They have very different needs, and I'm finding that the services that we offer, and I mean there's a myriad of services, no doubt about it. They're not exactly getting to the heart of the issue. That's one concern I have. The second one is that I've been very involved over the years in developing curricula and training of nursing aides. And I see at that level, entry level into healthcare, as well as home health aides, and even in the nursing programs, we're in a big rush to try to fill the vacuum that has been created by many things over decades. The pandemic just turned over a few rocks, I think, and showed how acute the shortages are. But my concern is that we not fill that vacuum with well-meaning, good-hearted, marvelous people who are not trained properly. And we're kind of, I don't like the phrase dumbing down, but I think that that's an issue, that we need to provide the young people or middle-aged women, many of them are transitional women moving to a different career perhaps, that we provide them with more rigorous training and more of a clinical component, so that when they're confronted with issues in the home, they have a resource, they have backup people that can help them, and also so that they feel good about their work and their learning and growing, and not feeling kind of scared in a way when they're alone in a home and they don't quite know what to do or how to handle the situation. So those are two main concerns I have. And finally, I'm extremely optimistic that there are ways to get what older people need to them, and also to try. The biggest challenge is to get people to understand not to wait for a crisis. Big crisis is a fall. And we know that with all the programs we have in place, that the fall rates are going up in the state of Vermont. And that's not just because we have more old people like me. It's that something's not working, is it? If we're throwing everything at it and the rate of falls continues to increase, that begs the question, doesn't it? What do we need to do better, do different? cetera, et cetera. Anyway, so that's a lot. So I'm going to be quiet now. Thank you.
Yeah, those were all really, really important comments, Regina. Thank you for sharing. I agree that, you know, we don't want that training is really, really important. I was actually on a meeting earlier this morning about that topic specifically. And ensuring that it gets to the right organizations, the right people at the right time is key. And as you said, the issues people face at home are complex and unique, right? And it's very difficult for a healthcare provider, a primary care practice to know everything that's going on at home, but it's such an important piece of keeping people healthy overall. So we need to be training folks really well. Anyone who's going in the home to be really watching for that. There are some great I think efforts going on to really try to increase our work around falls prevention. That's another really complex issue, and there's many factors that go into what might cause a fall for someone. So we need a lot of work on that front, because it's not just about, you know, staying physically active, although that's really important for people, but it's around the accessibility of the housing and the sidewalks in the community. It's about hearing and vision and medications and so many different things. So lots more work to do there, which I think is why it's called out in the plan as a really important objective to address.
Thank you, Angela, and thank you, Regina, for those very thoughtful comments. Any other questions that are rising for folks, or reflections, or some feedback on the plan?
Do we have, can you hear me?
Yes, we can.
Do we have full representation on any of the committees or discussion groups or whatever? I mean, in person, live, active engagement from older people who actually are living the experience. You know, we need the energy of younger people and the knowledge, et cetera. And I think that the older people who actually are experiencing these things, at least in my view, from where I've been around, are underrepresented. And some of the things that we're doing, we've been doing them for longer periods of time than I can even remember. I mean, I can remember being involved in Vermont way back when writing curricula for the Nurses Aid program. That was way back. And instead of, I think, putting more emphasis on finding out more about what is it that the old person who finds themselves in this situation is actually experiencing. I guess I'm referring to, I was a part of a study over at Dartmouth where we were trying to determine whether or not caregivers could benefit from a digital sort of support system where a caregiver was assigned someone. I happen to be one that volunteered to do this. And the stories that I heard from people who were caregivers, I mean, absolutely would just bring you to your knees. I mean, they were so moving and so much stress, which we talk about that a lot, but hearing these voices, I mean, I was just blown away. And they're not feeling supported. And I was hearing it from them. And so they didn't know me from a hole in the wall, and there was no personal connection. So it was a very objective exchange, and they were telling it like it is. And they didn't feel supported in spite of many opportunities or efforts, all valid and coming from, you know, people with very good hearts. So I just keep thinking to myself, we were doing the same things, just more of it. And what do we need to do to unlock all of these valiant efforts and expensive efforts in some cases in order to actually have evidence-based change? You know what I mean?
Yeah, yes, absolutely. I think that's really important. I just to answer your first part of your question that was around our older Vermonters, part of the part of the groups that were developing this plan, and then will they be part of implementation? The answer is definitely yes. We were very intentional about having several older Vermonters on our advisory committee, and they've been
Good.
active participants in the subcommittees developing the work, including family caregivers, older veterans, as well. And so we want to continue that. We also did a special focus group specifically with family caregivers. And they shared many similar things to what you're saying, Regina. And that was very informative for the work and will be ongoing.
Good.
And there were also extensive listening sessions around the state as well, listening to older Vermonters, their perspective on the topic areas that are covered in the plan, as well as a broader survey that was conducted by AARP. And we had about 2,400 responses across the state, I believe. It's been a while since I looked at that survey, but it, not necessarily reflective of everybody, but certainly there were a lot of chances to provide input, and also specifically on where there is needed. 2,800 responses, thank you, which is quite high statewide. Any other questions from folks? All right, well, I'm going to go ahead and Angela, I'd like to have you just go over one more time, just the sort of follow-up steps so people have that front of mind. I know that you covered that in the last slide. We will send out a link after this webinar to the recording that will be on the AARP state blog page, as well as a link to the Age Strong plan, which those links are also in the chat. If you haven't had a chance to save those, you will also get those in an email as well. The slides will be put up there by the end of the week or early next week as well, if you want to be able to access those slides, but you'll be able to access the full plan on that website, as well as an interview that Angela did with Fran Stoddard a few months back on the plan as well. So Angela, I'm going to turn it over to you, and then we will close out the webinar. And I just want to thank everybody for joining us.
And thank you all for all the work you're doing.
Thank you, Regina.
Appreciate it.
Yeah, thank you. And thanks, Kelly. I'm just going to try to address a couple questions that just came in the chat really quickly, and then I'll wrap up. Tree asked about a Facebook group for older Vermonters. I believe there is a Facebook group for older Vermonters that was started a couple of years ago. So I think it's just called Older Vermonters if you look it up. I'm not sure how active it is now, but I know it was a couple of years ago when I was doing more of the checking on that. Also, are there some Vermont communities who've made a firm commitment to supporting the Age Strong plan? And I think that the answer to that is yes as well. And we're looking to expand to more communities through our partnership with regional planning commissions and town governments and such. But the Burlington Aging Council is one that has partnered, and they're using the Age Strong Vermont objectives to develop the local objectives for Vermont, or for Burlington, kind of coming up with a similar local plan that complements the state plan. So really trying to stay in close touch and support that work. And then also in Windham County, there is a group out of Brattleboro and surrounding towns called Windham Aging, and they have really taken on this work as well at the local level. So looking at what we're doing at the state level and supplementing that and focusing in on the needs in Windham County. So there are a few different communities that have really taken on this work and using a similar approach, and we're staying in close communication. And we hope to bring on, more communities and counties or communities in whatever capacity will take on this work as well. And I think there's something for everyone in this plan. There's really an opportunity for everyone to get involved, whether you're local government, community-based organization, or an individual volunteer. So with that, I will finish by just encouraging you to stay engaged. If you would like to read the plan, to sign up for the newsletter, we do a very short monthly newsletter just so you can keep up to date on this work or get involved as we move forward with different initiatives. And we do intend to be accountable to progress along the way. So we'll be putting information out publicly as we move forward with efforts. It will be an evolving effort as we continue to try to find the resources to move the work forward, as well in collaboration with all of our partners. So again, healthvermont.gov/AgeStrongVT is where to go to read the plan, comment anytime, or and connect in multiple ways. So really appreciate your time today. Thank you all so much.
Thank you, Angela. Thank you very much. And just in closing, we'll encourage folks to reach out to their local lawmakers about this plan, because it is really important. And as Angela shared, it's important that this plan is well resourced, that these policies get passed. So reach out to your local rep, your senator. If you need help finding that person, please feel free to reach out to me. I will put my email in the chat, and I'm happy to help make that connection as well. And it was wonderful to have all of you join us, and we look forward to you staying involved. Thank you so much.
Thank you.